Yes, I'm a general practitioner in England, and I have type 1 diabetes.
Right.
And I've had type 1 now for 27 years. And for the last 7 years, I've been on a ketogenic lifestyle, so very low carbohydrates. And that has revolutionized my life.
All right. Hello, everyone. We're just walking away from our dinner. Thomas Weimbs here. So I'm here with my new friend Ian Lake, who I've met for the first time at this conference. We had, previously emailed. And so we're at the Keto Life conference in Switzerland. Oops. Just got a thank you. All right. And I was thinking we could talk some type 1 diabetes.
Excellent, that's my subject, Thomas.
Yes, perfect.
Absolutely.
And we could maybe sit down somewhere. So we're here in this beautiful giant hotel. Maybe if you look around, staircase and all. It's right now pretty empty. So Ian is an expert in type 1. And maybe we'll just sit somewhere here. Put my wine glass down. All right. And so Ian, so you're a doctor?
Yes, I'm a general practitioner in England, and I have type 1 diabetes.
Right.
And I've had type 1 now for 27 years. And for the last 7 years, I've been on a ketogenic lifestyle, so very low carbohydrates. And that has revolutionized my life, really, which is why I'm here at the Keto Life conference.
Good. Well, no, you guys gave all the punchlines away already.
Good.
So to recap, so you're a doctor. You probably treat people with type 1 diabetes. I'm assuming some.
In the UK, I'm a general practitioner, so
Right.
most type 1s are treated within a secondary care setting with consultant diabetologists and specialised nurses.
Okay.
But we get enough people with type 1 passing through.
Right.
And because of my knowledge of a keto diet, I'm considered a reasonable specialist within general practice for keto diets.
Right. Yeah, and of course you have type 1 diabetes, so you actually know what you're talking about when you
I do
treat
indeed.
someone with type 1.
I do. Yeah.
Right. And what I find, so I'm always puzzled about type 1 because my understanding, I'm not a doctor. I'm a doctor, but not a medical doctor.
Yeah.
So my understanding is that the typical treatment for type 1 is, or the typical advice is, don't worry about your carbohydrates so much, eat whatever you want, as long as you take the right amount of insulin, to balance it out, live your life, and don't care about it. Okay. Knowing a little bit about physiology and how this all actually works, right? So someone with type 1 obviously has no insulin, right? And the body doesn't produce any insulin. And what insulin does, of course, is it reacts to blood sugar rising and pushing it back down, right? So if the blood sugar never rises, theoretically, you don't really need insulin, right? At least not almost none, right? So what I would think, if I were an alien beamed down to this world, and trying to figure out what to do with someone who has type 1 diabetes, I would say, obviously, you don't give this person any carbs. Seems totally normal and obvious, but that's not the advice.
No, the current advice is that you have a normal diet and you manage your insulin around carbohydrates. There's no specified amount of carbohydrates for type 1. Some charities would say there's no lower limit or upper limit of carbohydrates. But in practice, most people are encouraged, I think that's probably the right word, to have the conventional diet of healthy whole grains, carbohydrates around 50% of your intake, healthy fats, fairly low fat, a normal protein, cutting out refined sugar. And then the idea is that you have an estimation of the amount of carbohydrates per meal, and then you inject the right amount of insulin to suit what you've estimated the carbohydrates to be. And in theory, when you inject insulin, the timing for insulin should coincide with the peak of your carbohydrate absorption to the bloodstream of glucose and then you should be able to normalize your glucose levels to between sort of physiological levels between 4 and 6.
And I heard a lot of shoulds. It should work like
It should
that,
work.
right?
So that's the theory.
Right, in theory.
And,
right.
and I think what happened was when insulin pens were invented in the very early 1980s, I think what happened was the life of someone with type 1 before that, it was mixed insulins, and it was very difficult for them to have what I'd call a normal life or a spontaneous life, because if you injected a mixed insulin, it meant that you had to anticipate the onset of action of your second insulin, if you like, which is longish acting insulin. So you were always eating around hypos really, or trying to avoid hypos. And then when pens came along, it happened to coincide with the low fat diet and the high carbohydrate diet. And of course pens gave you that flexibility to eat when you like, in theory, and inject insulin according to the amount of carbs you have. The problem with that is it's almost impossible for some of us, and the vast majority of us, to actually balance the carbs with the insulin. So most people's glucose surges up or down, and you rarely get it in the middle of the normal range.
Right, yeah.
So the recommended range for someone with type 1 is 7%, which is 48 millimoles per mole in European. The normal range is 6% for someone who doesn't have diabetes. But unfortunately in the UK, 70% of people with type 1 have an HbA1c of 7.5% or above.
70%.
70%.
Wow, so most,
and that hasn't changed with pumps compared with pens. It hasn't changed with artificial pancreases materially. It's gone down a few points, but not enough to make a difference. And at that level, if you have an HbA1c above 7.5%, which 70% of people in England and Wales do, you lose 100 days of life every year, according to the European Association of Diabetes.
Maybe just to recap, that was fast. So what Ian was saying is, yes, in theory, a patient with type 1 diabetes can juggle their blood sugar level by just injecting just the right amount of insulin at just the right amount of time, and just being very highly educated about it all and extremely disciplined, and having all the tools available, and measuring maybe their blood sugar frequently. And if you do all this completely perfectly, you're fine. Okay, case closed. Like most people, they're not perfect, and they have a really hard time controlling the blood sugar. And 70% have high enough blood sugar on average that the marker A1C is just elevated, which costs you life, years of your life. So in theory it all works. In practice it actually doesn't. One would think a logical solution should be, okay, let's not even add the carbs that your body can't really deal with. Let's just not deal even with it to begin with, which is not what happens. But there's a solution, of course, which is just not to add those carbs, and that comes down to a ketogenic diet, which is a very, very low carbohydrate, high fat diet, which is what he has been implementing for himself and for his patients, I'm assuming. And probably most doctors, conventional doctors, if a type 1 patient comes to them and says, hey, I want to do a keto diet, they would freak out and start yelling at the patient and start saying, hey, you're going to kill yourself. I'm not going to support you. But in reality, it works, right?
It's absolutely spectacular. I remember from day one of trying the keto diet, I got perfect glucose control, and that sort of drove me on to carry on.
Right.
Luckily for people with type 1 diabetes, carbohydrates are the only macronutrient compared with fats and proteins which are not necessary as part of the diet. So carbohydrates provide energy, but they do not provide any other nutrient value. Yes, within brown wheat, brown flour, etc., there are nutrients and fiber, etc. But there's nothing in carbohydrates that can't be accessed from other macronutrients. So it's lucky for people with type 1 that carbohydrates are dispensable. And it's also fortunate to some degree that carbohydrates are the main driver of high blood glucose. And if you have high blood glucose, you need insulin. So if you cut down your carbohydrates, clearly you don't need to take much insulin, because carbohydrates are the biggest driver of high glucose. There are other drivers of high glucose, protein to some degree, fat to a minor degree, and also other stress hormones can raise glucose, and insulin is required to bring it down. But by far the biggest driver is carbohydrate. So if you cut your carbohydrates, you need less insulin, you get smaller errors. So it has been shown that people who have type 1 diabetes on a keto diet have up to 6 times fewer hypos, have near normal glucose control throughout the day.
Hypos means hypoglycemia.
Hypo is hypoglycemia, which means you have to take sugar.
Exactly.
You feel a bit strange, you possibly have spots in front of your vision, you certainly feel urgent, you're at risk of blacking out, and you need glucose to rescue that.
Right.
That's not an uncommon thing. It happens to minor degrees in most of us, several days of the week probably, but not to the degree where you need help. It's just minor irritant really. But with the keto diet, it reduces hypo 6-fold.
Right.
It normalizes blood glucose, and it's a fantastic way of going on.
Okay. Also hypos, hypoglycemic episodes are a cause of death potentially, right? So you can die from that. If you reduce the risk for that by going on a ketogenic diet, then it seems pretty logical to me to do that. But what do you think is the reason why it's not common practice? Is there actually a reason for that?
I think we've all been brought up to fear fat. And the whole of my life as a doctor, 30 odd years of being a doctor, we've been brought up to think that fat is a cause of heart disease. And of course, if you cut carbohydrates from your diet, you have to replace it with something else. So you naturally would replace it with a higher fat diet. There are healthy fats, but I think most doctors believe that fat is a cause of heart disease, and certainly there is an association between high cholesterol levels, which are driven by animal fats, if you like, and heart disease. But it's not absolutely proven that saturated fat, which is present in animal fats, is a cause of heart disease anymore. And one of the biggest drivers of fat production, strangely, in type 1 diabetes is carbohydrates, because if you're eating more carbohydrates than your body needs, it converts them under the influence of insulin into fat.
Right.
So I think it's unnecessary to be frightened of fat. And as I talked before, when you lose 100 days of life if you don't have very good glucose control, you have to balance that with the tiny advantage you get by reducing fat from your diet.
Yeah.
So it's a balance, a risk management thing.
Right, yeah. Type 1 diabetes used to be a deadly disease not too long ago, and it is still, a very dangerous disease. I would actually think, the danger, if it even exists, of high fat doing anything bad to you is the least of your problem. If you have type 1 diabetes, you have other things to worry about. So what? But I still don't understand. I mean, it rationally makes no sense, right? To just say, hey, maybe fat might kill you 50 years down the road, which it doesn't. And to tell that to a type 1 diabetic, rationally makes no sense. It's well, I guess we will never figure out right now why it is still the case. Do we need studies that prove this better? I mean, is there...
I think there are no long-term studies on the beneficial effects of ketogenic diets because none have been done, and I don't think that any are underway. But of the studies that have been done on low-carb diets, it has shown that the long-term measure of glucose control is much improved. And also the day-to-day variation of glucose is much improved, so people get near normal glucose levels. For example, for the past 7 years, I've never been in the diabetic range for my long-term glucose control, which for me is remarkable, because before that I was way out of control, and I was trying hard, and everybody said, oh, you're a doctor, you must know how to control diabetes. Well, yes, I do, but I found it in practice very, very difficult. And of course, if you don't have what I call an even energy lifestyle, so if you're doing a bit of cycling, doing a bit of running, doing a bit of sedentary life, it's difficult to balance your carbohydrate intake and your insulin intake with your lifestyle. So unless you have an absolutely regular lifestyle, it makes it even more difficult to control. So for me, it's easy. It's logical. It follows the science, and the fact that carbohydrates are unnecessary is lucky for people with type 1 diabetes. I've halved my insulin volumes, and I can only think in the long term that's going to be good, because if you continually inject high volumes of insulin, you put yourself at risk of type 2 diabetes on top of type 1 diabetes, and in that situation you are at increased risk of heart disease, or increased risk of obesity, and you're increased risk of continual high blood glucose, which, as you know, damages your kidneys, and it damages your retinas, and it damages your blood vessels generally. So for me, it's a very good way of managing diabetes, and I'm trying actively to promote it, because it makes complete sense. I think it's outdated. I think we need a new paradigm of care, and that paradigm of care hasn't become part of the consciousness of people who manage diabetes yet.
Yeah, interesting. Of course, the demand is always there for, show me the randomized control clinical study published in the New England Journal of Medicine, and a study like this costs, millions and tens of millions of dollars, maybe even more. Who would pay for it, right? So obviously nobody, because a ketogenic diet makes nobody rich. So nobody has an incentive to invest in that. Well, of course, there's a public incentive. Health insurances. They might save a ton of money if they have to pay less for insulin, and they have fewer sick people, developing chronic kidney disease. I'm not quite sure how we would get to those folks and say, hey, let's fund this study once and for all and start treating type 1 different. I guess we just have to spread the word. Maybe somebody, if you're out there, you work for a health insurance company or for Medicare, pay attention. If you want to save money, do a study, or ask Ian to do one for you. Fund his work. That might be a solution, maybe. All right. But I think other than that, spreading the word, even on the internet, with credible sources, I think is a way to go slowly.
I think people are slowly getting it, and certainly the people that do find it, mostly by accident, are very grateful that they found it. And people with type 1, as I say, you get control literally from day one, and it's such a spectacular change in your fortune that most people get actually quite irritated that they weren't given this information before. So I've written a couple of courses on how to manage ketogenic lifestyles for type 1, aimed at healthcare professionals, so at least they won't hinder their patients from moving on. Because at the moment, 50% at least of healthcare professionals actively discourage their patients from going into a keto lifestyle, and nearly all of the reasons why are completely invalid and unscientific. So it doesn't make any sense to discourage people from going onto a ketogenic lifestyle. So I'm very keen to promote that.
Okay. Good. Well, Ian is a very polite man from the UK. I'm maybe less polite as a German. I would almost call it medical malpractice to keep treating type 1 diabetes the way people have been doing it. All right, quote me on that, sue me. But all right, where can people get help? So they can, you said you have a course available for practitioners. So let's say there's a patient out there. Where can they send their practitioner to?
Well, my website is www.type1, which is the number 1, type1keto.com. Patients themselves can get in, patients themselves can get enough information to start a keto lifestyle should they choose to do so. But it's also helpful to have the support of your healthcare practitioner, because they are the ones that sort of monitor your insulin. If you're on extra drugs or if you have complications, you'll need expert help. So I always advise people to take advice from a healthcare professional. But if the healthcare professional is actively discouraging you, that makes it provides quite a dilemma for the poor patient. So I've produced on my website, there are courses now for healthcare professionals of all grades. So they will be able to understand the rationale for keto, understand how to help people who have already got complications, and just sort of know what, if you're a type 1 that has gone keto, understand you, and which is great help.
Right.
Because, we all take, our healthcare professionals are studied for a long period of time to help us. And, we like it really as type 1s when healthcare professionals are on our side, if you see what I mean.
Right.
And when we know we're doing well with a keto diet and our healthcare professional doesn't appear to be on our side, it's quite irritating, especially if the reasons they have for not being on our side aren't valid. Right. So that will help everyone, I think, to get on the same page, and hopefully we'll move people with type 1 into the normal range. In the long term, we'll reduce complications. In the short term, we'll reduce acute complications such as hypoglycemic attacks, low blood sugars. And of course, that will benefit everyone because if you're driving and have a hypo, it's quite a compromising situation. You have to stop your car, you have to get in the opposite seat, so you take the keys out of the ignition, etc. And 10, 20, 30 minutes of your driving has to be stopped so you can restart, and of course the danger to the public is immense. So a keto lifestyle will help in so many respects, and it is so freeing. I mean, I can go all day without eating, and that was unknown 7 years ago for me. So I can almost forget my diabetes as someone with diabetes, which is a remarkable thing to happen. And I'm so privileged to have actually accidentally bumped into a keto lifestyle. Right. But it suits me enormously, and I'm quite keen that at least every type 1 knows that it's out there. Right. If they choose to do it, that's entirely up to them. But I think if you lived your life, had complications and didn't know, I think that's such a sad thing, really, and I'm quite keen that everyone at least has the information available to them.
Wonderful.
Because it's transformative for your life.
Okay, amazing. All right, so healthcare professionals can get information on Ian's website. Are you on social media as well?
Yeah, I've got a Twitter @IDLake.
Okay. Yeah. I'll try to link all this down
there. Thank you. It's a fairly small website. Really.
Okay, yeah, but get in touch. Tell your healthcare professional to check out Ian's website. And, there's always, in the US, I would say there's a choice of healthcare practitioners that may not be as easy in the UK, of course, as I understand, but, you can make choices, probably. Great. Well, thank you so much, Ian.
Thank you. It's very enjoyable. Yeah. Just one last thing to say. Yes. If you're a healthcare professional and you happen to be watching this, it is such a rewarding experience for you as a healthcare professional to watch your patients transform in such a short space of time. And it's, I'd strongly encourage at least you know about keto, because you get such immense job satisfaction from this.
Perfect. Wonderful. Yeah. And that's kind of what this meeting that we're at is kind of all about, actually educating doctors, dietitians, and so on, providing those resources on the somewhat pioneering, radical ideas that are out there, but that actually work. All right, great. Thank you, Ian.
Thank you very much. Thank you, Thomas. Very enjoyable.